This is the line cart. Has all the equipment that you should need, and it usually is fairly well stocked. So if you bring this over to the bedside, then you'll have all the equipment you need. Instead of using the bottles of chlorhexidine prep, we'll now be asking that you use the lollipops. So these are the lollipops that are stained pink. There are some that are also clear and smaller, which you can use as well. It doesn't matter for afterwards, but for the initial prep, we encourage you to use the ones that are stained pink so that you can see the area that's been prepped. So now we're going to prep the skin. So you can see that our resident here has just put on non-sterile regular gloves, and he's going to take the lollipop. The lollipop itself is not actually sterile. While it's wet, it's not actually a sterile surface or solution. It has to actually dry to be sterile. So right now he's pretending to be applying prep for doing an IJ, sort of similar for a subclavian. So you can see he starts in the center and just works out and preps a huge area. So yeah, I would go even larger than that. Just prep a nice big area all the way up. Now, because we're on a simulator, we're just going to prep where the tegaderm is for today, but you would prep as large an area as you possibly can. If you need to use a second lollipop, feel free. Okay. So Andy already has his cap and mask on, and he's going to wash his hands before he gowns and gloves. So that hand washing or use Purell is done just immediately prior to gowning and gloving.
I should have opened the gloves and gowns first.
Now you can use, if you're washing your hands, you can use that top green towel to dry off your hands. If you're using Purell or something like that, you can just throw away that green towel. So now he's going to...
Gown's closed inside out. So you can open up the gown. Take the two ties.
Now you can either do it as he did there, or you can have someone else do up the top tie for you. Obviously paying attention to not contaminating your arms. Now you're going to see as he picks up his glove, he keeps his hands inside the sleeve. So Andy, if you want to just describe what you're doing.
I'm just going to layer my glove right on top of my hand and my sleeve. So with my fingers inside the sleeve, I'm going to grab the edge of my glove. It's a little tricky at times because the gloves stuck down together.
The main thing is if you keep your hands inside the sleeves, then
nice
at all
sterile.
times, then the cuffs are sterile.
You maintain sterility. So you just want to make sure. And of course, this is more tricky.
But this is realistic, so we're non-surgical people, so we're demonstrating the reality of people who don't do this on a regular basis. You still can do it.
Flipping it inside out, and now my entire hand and sleeve and fingers never exit my sleeve. So I have one hand to work with. So for the same thing, I'm going to take my glove, I'm going to just leave it right on top of my sleeve with my fingers. I'm going to grab onto the edge there. I'm going to grab onto the inside edge. I'm going to fold it over, pull it over, and that way my fingers never leave the sleeve, and I've maintained sterility while putting on my gloves.
There we go. Okay, great. Thank you very much, Andy.
No problem.
So now that our resident has his cap, mask, gown, and gloves, and the patient is prepped, the nurse will hand the drape to the resident. So it just banana peels open. You can see how he banana peels it there. Everything inside is sterile, so he just grabs it out. So you can just discard the top sheet, and he's going to open up the outer wrap. You can see he's controlling it, so just flipping it back so it doesn't flip around and touch anything and get contaminated. And he's just going to pull the drape out of the package there, and then he can just dispose of that. So if you can just hold it open, you can see that there's a hole, and there's a piece of white paper covering up the sticky portion. So you just pull off the white paper that's to expose the sticky tape. It helps hold it in place. Then we're going to place the hole over the area where we want to put the line. The hole is in the center and it's completely square, so you can't make a mistake. Now he's just going to unravel it. And it should fit over the handlebars of the bed. And he's being careful not to contaminate himself in the process. And an assistant, if you need, can help pull down the lower end. So the lighter blue underside the nurse can touch, or an assistant, and it won't be contaminated. Being very careful not to touch the top blue side. Okay, so there we go. So you can see it goes from about the femoral area up over the handlebar, and we have a nice large clear plastic area and a 4-inch hole where you can do your ultrasound and line insertion. This extra little piece here you can just remove and dispose of again. And now you have your patient draped. So now we are going to drape the ultrasound probe. So you can see he's pulling off the little piece of paper that exposes the sticky plastic. You want to get a nice seal on the ultrasound probe without any air pockets. And you see how he has his hand in it, and he's just going to slide it down now, holding on to the ultrasound probe with the other hand. Then there are some tapes there that you can